For this part of the assessment, we will be doing active range of motion at the hip, starting with flexion. So I will give the client a command for them to do, and they will carry out the movement. So for flexion, I will ask them to bring their knee to their chest. By doing flexion, it will activate the rectus femoris, the sartorius, the iliacus. Now here I'm doing passive, so I'm just bringing the client's knee into flexion, with them being as relaxed as possible. And then lastly, it will be restricted range of motion, so I will be applying a force and they will have to be matching my force, and I will be checking for any pain throughout, looking at the quality of movement and any compensation when carrying out the movement. Now we are moving on to extension of the hip, starting with active. So I will just be asking the client to bring their foot up towards the ceiling. When doing extension, it will activate muscles such as the gluteus maximus, the hamstring group, so including bicep femoris, semimembranosus and semitendinosus. Here I'm doing passive range of motion, so I'm taking the weight of the client and doing the movement for them. And lastly, it is restricted range of motion. So for this, I will be applying a force while they carry out the movement, and the client will match my force to carry the movement out. Throughout, I'll be asking for any pain, looking at the quality of movement, and any compensation. For this part of the assessment, we will be doing active range of motion for adduction. So for this, I will be instructing the client on what to do, and they will carry it out. When doing adduction, it will activate muscles such as the gluteus maximus, the gluteus medius, and the gluteus minimus, along with the tensor fascia lata. So here I'm just holding the client's foot up for them so they can bring their leg inwards, and then I'm doing the same on the other side, making sure to ask for any pain, and looking at the quality. Now here I will be doing abduction, so I'll be asking the client to hook the leg that isn't carrying out the movement off the bed, and then bringing the other leg away from themselves. For this part, we will be doing passive range of motion, so I'll be getting the client to relax as much as possible, and I'll be taking their weight. So I'll just be stabilising them at the hip and bringing their leg outwards to create the movement of abduction. With abduction, muscles such as the abductor magnus, the abductor longus and abductor brevis will be activated. Here we are now moving on to passive range of movement by doing adduction. So again, stabilising at the hip and then bringing the leg over the other leg. As always, starting with the non-injured side and then working the way onto the other side. And now I will be doing restricted range of movement for adduction and abduction. So to start with abduction, I will be holding the outer part of their ankle and asking them to push outwards while I push inwards. And then for adduction, they're posing, so put my hand on the inside of their ankle while they push inwards and I push outwards. And looking at their face for any hesitation or any pain at all. So for this part, we will be doing active range of motion for internal and external rotation at the hip. So I bring the knee to a 90-degree angle and then ask my client to bring their foot inwards, which will create external rotation. And then I bring it back to the middle and ask them to bring it outwards for internal rotation. Again, checking the quality of movement and for any pain. Now we'll be moving on to passive range of motion for internal and external rotation at the hip. So I'll be taking the weight of my client and putting them into the movement. So here I am just bringing them into external rotation at the hip and bringing it outwards for internal rotation and asking for any pain. Here we will be doing resisted range of motion for internal and external rotation at the hip. So I will be applying a force to my client and they will be matching that force. So here we are starting with internal rotation at the hip, so my client is pushing outwards while I am pushing inwards, and then the opposing movement where of external rotation at the hip, where they will be pushing inwards and I will be pushing outwards. For internal rotation, it will activate muscles such as the gluteus maximus and minimus and the iliacus, and for external rotation, the gluteus maximus and the piriformis. For the functional test, I will be asking my client to do a lunge, so just stepping forward and then lowering themselves down.